Good afternoon, and thank you for joining our webinar, What Happens if Obamacare is Repealed? I'm Julia Goebel, Chief Marketing Officer at Benefit Express, and I will be your moderator today. A few housekeeping items before we begin. If you missed something, don't worry. We'll be emailing you the recording and the slides after the webinar concludes. I'll be keeping the webinar muted to avoid any background noise. We will pause throughout for questions. Simply type your questions in the chat box below and I will read aloud for you at the end of each section. If we don't get to your question today, we will be sure to email you a response. Now I'm pleased to introduce our distinguished presenter. ERISA attorney Larry Grudzien is our presenter today. With more than 35 years experience in employee benefit law, Larry has a wealth of experience in dealing with qualified plans, health and welfare, fringe benefits, and executive compensation areas. Thank you for joining us today, Larry. We are delighted to have you.
Thank you very much.
I will ask you to take it away.
Thank you. Thank you very much. This is an important discussion because the fact that there was it's before the United States Court of Appeals in the Fifth Circuit in New Orleans. They heard arguments on July 9th. It was a Texas decision that came down late last year. And basically what the court did is indicate the fact that since the individual mandate penalty is now zero, they felt that the whole structure of Obamacare was based on that tax. And because that tax is now zero, he felt that the Obamacare, the whole thing, would be unconstitutional. And they keyed it off of the Supreme Court decision that came out in 2012 that basically saw that the tax made Obamacare constitutional. So the issue is, over the next few weeks, what the Court of Appeals is going to decide. And what you have to look for, if the Court of Appeals announce their decision shortly, are they going to issue an injunction stopping Obamacare? Or are they going to, because the district court in Texas didn't issue that? And so whoever loses the appeal is going to appeal to the Supreme Court, and probably it won't be decided until sometime in 2020. So all of us are basically holding our breath on this to see exactly what happens. I think there's a 50-50 chance that Obamacare is going to be repealed. So I think this is something what's important to look at, especially how Roberts decides on this, because he was the deciding vote in 2012, and he may be the deciding vote in 2020. So it'd be interesting to see. So as this slide indicates, the Texas decision, if it's upheld, tens of millions of more people will be affected, both individuals and businesses. So it affects all kinds of things, and the purpose behind this presentation is to give you a full breadth of exactly if the court decides to issue an injunction, or if the Supreme Court sides with the district court and feels that Obamacare is now unconstitutional. Because remember, in 2017, the Congress, now the individual mandate penalty is still there, but it's zero. So in the Tax Act that was passed in 2017, they reduced the tax to zero, and so that's what they're honing on. Oops, sorry. So the question in the heart of the case is whether the Affordable Care Act's mandate requiring most Americans to buy health insurance or pay a penalty remains constitutional, as I said in 2017, when Congress eliminated the penalty. Now, they didn't eliminate the penalty, they eliminated the penalty is still there, but the penalty is now zero. And what's important is the whole crux of the matter, as I indicated before, when the Supreme Court upheld the mandate in 2012 and a ruling that saved the law, its decision was based on Congress's power to impose tax. So they didn't say it as a penalty, they indicated that it was a tax, and therefore that's why it was constitutional. So with the tax being zero, that's what everybody's going to look at and see how they rule on this. So the question here is, if the mandate is declared unconstitutional, whether they can, whether they're going to save certain sections of the Affordable Care Act. But the decision in December indicated that it was intertwined, and if one section of Obamacare is unconstitutional, the district court indicated that the whole thing has to go. So that's why everybody's interested in this, and there's a 50-50 chance they're going to declare the whole act as unconstitutional. So that's what we're at right now. We're waiting with bated breath because the arguments were in July, and it's been a few months, and so far there's been no indication when the court's going to decide. So the next thing we're going to do is talk about what the effects are on individuals. And the first thing I want to talk about is what happens, and there's going to be millions of people that are going to lose their health insurance. And the first thing we're going to look at, 23 million people either buy health insurance through the marketplaces or receive coverage through the Medicaid. And 9.2 million of these receive federal subsidies. And part of Obamacare, what they did in many states to expand Medicaid, before you can only get Medicaid if your income was at the poverty level. And basically on Obamacare, the states, if they decided, many states did, it was now 133% of the poverty level, which is a third higher. So because of that, more people were eligible for Medicare where they were not. And to encourage states to expand it for a period of time, the federal government actually paid 90% of the cost of the expansion of Medicaid. So again, on average, subsidies covered $525 of the $612 monthly premium, and with 39 states that use the federal marketplace. So many people, again, are using the marketplace, and many people are getting subsidies. If the marketplaces and subsidies go away, and now instead of paying $100 and something, you're paying $612. Many people are going to again drop their health insurance. Now, states could probably replace this, as I said, the full amount of subsidies with state funds, but again, I don't think that's going to happen. So the first thing we're going to look at is the fact that marketplaces will go away, and the subsidies will go away. And so the question is, what mechanism will be there to replace the marketplaces to people to buy insurance? Are they going to buy it the old-fashioned way, going through not through the exchanges, but through the insurance companies or through a broker? And again, now, if Obamacare is declared to be unconstitutional, they're going to have to pay full freight. Now, again, as I had said in the introduction, the major expansion of healthcare was through Medicaid. Here, Medicaid, the government insurance program for the poor, is jointly funded through the states and through the federal government. And what has been estimated, as this slide indicates, 12 million low-income adults who have gained Medicare coverage through the law's expansion could lose it. And again, that's because of the fact that those eligible for Medicaid was expanded from 100% in many states to 133% of the poverty level. So, according to the Urban Institute, enrollment in the program could drop by more than 15 million. And what's interesting about this, even though people know it may be coming, so far, nothing has been introduced in Congress, and maybe something will be introduced in Congress this fall or in the spring in anticipation of doing this. So here it says, according to the Urban Institute, enrollment in the program would drop by more than 15 million, including 3 million children who got Medicaid and Children's Health Program when parents signed up. And the law ensures that states will not have to pay more than 10%. No, and again, if Obamacare is repealed, now instead of the states only paying 10%, they're going to have to pay 100%. And last year, it was estimated the federal government's half of this expansion of Medicaid was $62 billion. So it's a lot of money. Also, losing free health care would, of course, mean that worse access to health care, possibly worse health for millions of people. Studies have found that Medicaid expansion have led to better access to preventive screenings, medications, and mental health services. Also, Medicaid has, it's been in the news recently that the opioid addiction crisis in the country, Medicaid provides for spending on that. So here, healthcare law took effect just as the opioid epidemic was spreading to the corners of the country. And biggest benefits of this program is providing access to addiction treatment. It requires insurance companies to cover substance abuse treatment. And again, if this law is struck down, that assistance is going to go away. So again, this is another extremely important for individuals, the expansion of Medicaid. And again, the biggest group to have access under the law would be adults that have gained Medicaid treatment. The Kaiser Family Foundation estimated that 40% of people from 18 to 26 with opioid addiction, roughly 800,000 people, many of which are eligible through the healthcare program, will now lose their coverage. And Kaiser in 2016 found that Americans with Medicaid coverage were twice as likely as those with no insurance to receive any treatment for addiction. So again, this is going to be a crisis if this law is repealed. And how we're going to make this up. And states with expanded Medicaid are spending much more on medications that treat opioid addiction. From 2013 to 2017, Medicaid spending on prescriptions for 2 medications that treat opioid has more than doubled. And again, this reached $874 million, up from $358 million. And I think because people are starting to recognize the crisis, that spending will go up. And again, if this coverage goes away, it's going to be, again, a crisis. And again, growing insured population in many states have drawn more treatment providers, including Medicare clinics, inpatient programs, primary care physicians who prescribe 2 or more anti-craving medications and other drugs. These significant expansions of addiction care could shrink if federal grants are done away with. And again, this is the federal government over the last 6 or 7 years has been funding this. So again, another aspect of this is that after Obamacare was passed in 2010, one of the major factors of the expansion under Medicare was the elimination of pre-existing conditions, which was very common, especially in the individual market. And again, if you filled out a application back then, if you had any substantial pre-existing conditions, the chances are that the insurance company would not insure you. Now, what many states did across the country, they set up state risk pools that basically if the insurance companies did deny you, you could get insurance for these risk pools. The problem is these coverages to the risk pools are very expensive, and the problem is that some providers did not accept that coverage. So as many as 133 million Americans, roughly half of the population under age 65, have a pre-existing condition. And again, what the insurance companies will not cover will vary from insurance company to insurance company. So in this situation, that could disqualify them from buying health insurance coverage or cause them to pay significant higher premiums if the health law was overturned, done through an analysis in 2017. And again, existing medical conditions, and it could vary from insurance company to insurance company, include common ailments such as high blood pressure, asthma, any of which could require someone buying insurance on their own to pay more for the policy, or they could be denied. I know 15 years ago, I have a health condition, and I was denied coverage. Only one small insurance company would insure me, and many would deny me. So, I mean, this is something I have personal experience with. So under ACA, one of the protections is that no one could be denied coverage under any circumstances, and insurance companies could not retroactively cancel a policy unless they found evidence of fraud. The Kaiser Family Foundation estimated that 52 million people have conditions serious enough that insurers would either outright deny them coverage if the ACA was in effect, and its estimates are based on guidelines of insurers had in place to whom they covered before the federal law was enacted. Again, this was a real problem back in 2008 and 9, before this law came. So again, we're talking about individual coverage here. So again, what an insurance company would, and sometimes they would issue a policy, but they would exclude certain conditions. So you could not get treatment for those pre-existing conditions if they did write you a policy. So again, the need to protect people from existing medical conditions from discrimination by insurers was a central theme for midterm elections, and Democrats are trivial of their success in reclaiming the control of the House, but the voters denied safeguards for these protections. Now, many Republicans, including the president, have promised to keep this provision of the law in place. And again, there's no details in regard to how they're going to do this. And as I indicated before the law, some individuals were sent to high-risk pools operated by the states. But again, the problem was that many providers in the state would not accept this policy. The reimbursements are low and their premiums were high. Next, Americans will no longer face expensive treatments. Here, 156 million Americans who get coverage through an employer, as well as 15 million enrolled in Obamacare, are protected from caps that insurers and employers use to limit how much they can pay out in coverage. And this was an extremely, especially if you have chronic conditions, extremely important. Before ACA, people with conditions like cancer or hemophilia were very expensive to treat, enormous out-of-pockets, and many times there were caps in exactly what the insurance company would pay. Those caps, both on the individual side and on the employer side, have been eliminated. So it was found, and the reason why it was part of Obamacare was the fact that in 2009, before it was passed, while not all health coverage was capped, most companies had some sort of limit in 2009. And a 2017 Brookings estimated that 109 million people would face lifetime limits on their coverage without the health care. And some companies saying that it would cover no more than $1 million in medical bills. That was a very common cap. And again, for certain treatments, as you know, if you go to the hospital, that can be reached very quickly. Now, unless you have a chronic condition, the vast majority of people never hit these limits. But those who do are forced into bankruptcy to get treatment, or they go without treatment. And that's why it was put into the law. Also, the elimination of Obamacare could affect Medicare patients, Medicare beneficiaries. Could affect about 60 million people who are covered by Medicare. The federal insurance program that covers people over 65, and basically the changes from Obamacare affects every aspect of Medicare. And the overturning the law would be very disruptive. So basically what the law did, or what Obamacare did, they also made changes like cutting the amount of federal government paid hospitals and other providers, as well as private Advantage plans. And doing the cuts would increase the program's overall cost by hundreds of millions of dollars, because providers and hospitals could charge more, and premiums for as many as 55 million people under the program could go up. Also, ACA also was responsible for promoting experiments and new ways of paying for hospitals and doctors. If the groups save Medicare money on the care they provided, they would get, again, part of the savings. And about 12 million people are now enrolled in Medicare groups that are unclear whether that would happen if these experiments in the law were deemed unconstitutional. Now, some of President Trump's initiatives, as this says, like efforts to lower drug care costs, would also be hindered without a federal authority to establish under ACA. Now, one of the problems is the fact that people still need care. And if millions of people actually go without health care, doctors and hospitals cannot deny people. So doctors and hospitals could lose a crucial source of revenue, as some people lose insurance. And as it says here, the Urban Institute estimated that nationwide, without ACA, the cost of care for people who cannot pay for it will increase by $50.2 billion, because hospitals can't deny people in the emergency. So hospitals and other medical providers would incur the losses. As such, now high revenues and reduced costs for uncompensated through Medicaid, and therefore all of us are going to have to pay more to compensate that. So in a study in 2017 by the Commonwealth Fund found that every dollar of uncompensated costs from these states, the healthcare law had erased 40 cents in 2015, or $6.2 billion. And also the insurance industry would be up by the elimination of ACA. Insurance in many markets could again deny coverage or charge higher premiums for people with pre-existing conditions. States still regulate insurance, but again, one of the things for the first time what ACA did is that they uniformly applied standards across states. And again, before, states would vary exactly what insurance was required. So if ACA is eliminated, the problem is going to be you're going to see variations from state to state. Insurers could also see lower revenues and fewer members in the plans that operate in individual markets. So it's more far-reaching than I think a lot of people thought, especially in the individual markets, because payments are made to insurance companies, are made to individuals, are made to doctors, are made to hospitals, and all that would be eliminated if the ACA is repealed. Now, one thing that's very interesting that I didn't realize until I was researching this But one of the things, if you notice, if you go to restaurants right now, the calories are on the menu labels. The calorie count are on the menus, and this is one part of Obamacare. So here, as it says, an ACA requires nutrition labeling and calorie counts on menu items at chain restaurants. It requires many employers to provide reasonable break time and private space for nursing mothers. That's part of it. And it created a pathway for federal approval of biosimilars, which are near copies of biological drugs made from living cells. So again, this is far-reaching. So again, every aspect of the healthcare industry have been affected by Obamacare, and it's going to be interesting to see what's going to happen and if this is eliminated, and what's going to be proposed if the ACA is repealed. Is it going to be this far-reaching? Are this many people going to be covered? So what's going to happen, especially in the individual market on Medicaid? That's going to be very interesting to see over the next few months and years. Joy, do we have any questions so far?
At this time, we do not have any questions. Everyone, I would like to remind you, if you have any questions you'd like us to read aloud and ask and answer on the webinar, we are happy to. Simply type your question into the chat box shown on your webinar screen, and we will be happy to read it aloud. Thank you.
Now, one of the things that is extremely important just on the individual market, especially in the employer market, for the first time, the federal government imposed certain coverage requirements which were not in place before 2010. For the first time, the federal government basically mandated certain provisions, especially in the small plan market, like on the individual market with essential health benefits, for the first time. And they put standards exactly what has to be covered and what has to be included in an insurance contract, which was the privy of the state before, and the state insurance rules. And again, for the first time, the federal government indicated that. So one of the items in Obamacare, and this is probably the most controversial part of Obamacare, was preventive services were provided without cost. So under Obamacare, it requires all new health plans, including those sponsored by employers, to cover recommended preventive services without cost, bringing new benefits to 71 million Americans. So this means in this situation, the screenings, immunizations, annual checkups that catch illness early would be included without any co-pays, co-insurance, or deductibles. And again, this is the more controversial because part of the preventive care was contraceptives. And again, certain exceptions were created, and the Trump administration has created more. So again, this is one of the controversial, but also one of the more popular aspects of Obamacare. So again, women employees also can access affordable contraceptive, making available a wide variety of contraceptive choices and increasing the use of long-term contraceptive methods. So again, this would be eliminated if Obamacare was declared unconstitutional. Just like in the individual market, pre-existing condition exclusions were eliminated under the employer. This did not have the effect as in an individual market, because if you had credible coverage before, then your new employer could not impose a pre-existing condition exclusion. But if you had a break in coverage up to 63 days, as this indicates, they could impose a pre-existing condition exclusion for 12 to 18 months. So again, this is something that was eliminated, but the effect of it wasn't as severe as it was in the individual market. So again, if you lose your job and can't afford COBRA and went a few months without coverage and got another job, you could your pre-existing conditions could be not covered for a 12 to 18-month period. So again, this had an effect, but not as much as in the individual market. One of the more popular sections, both on the individual side and on the group side, is dependent coverage to age 26. So this requires all plans, insured and self-insured, to cover dependents up to age 26. And what was interesting about it, in the past, you had to be a qualified child or relative, and there are certain conditions you had to meet prior to 2010 to be covered up to a certain age. All that was eliminated under Obamacare, and what's interesting here, your children don't have to even live with you to be covered under the plan. So this was something that the Republicans have indicated they will keep in because it's extremely popular. But again, let's see what happens in this. And some politicians have actually criticized this. But again, this is something that will be eliminated if Obamacare is declared unconstitutional. Now, one of the aspects of this, and employers had to face this, is annual out-of-pocket limit. ACA requires all new health plans, including those sponsored by employers, to cap the individuals that can be expected to pay out-of-pocket each year. So limitations on exactly what an employee could pay under the plan. Prior to the ACA, even those with secure coverage on the job couldn't count on from crippling out-of-pocket costs. So this is something that was eliminated, and the insurance company and an employer plan could not impose that. Of course, those limits are rising every year. Also, there's a prohibition on annual lifetime limit. Eventually, it was ratcheted in over time. So the ACA prohibits employer plans from having annual or lifetime limits, just like individual plans. And prior to ACA, employer plans often included caps on benefits, and when the employees hit that cap, the coverage was cut off. For those who needed costly care, like baby born with prematurely or hemophilia, multiple sclerosis, that meant that they had to get other coverage to supplement exactly what the employer coverage would do. And again, this was eliminated, and now employers' plans have unlimited annual and lifetime limits. That will go away, and many employers would probably want to see that because it increased costs. Everybody's complaining, and this is one of the reasons why healthcare costs are increasing, because these limits were eliminated. Now, also was part of ACA, this requirement of external review. What's very interesting about this is that the ACA guarantees individuals the right to independent review of healthcare's decision to deny benefits or payment of services, regardless of whether the employer plan is insured or self-insured. Now, this is an extremely important deal because under ERISA, this was a new concept. Under ERISA, an employee has a right to an appeal, either one or two appeals. Once they go through this, the only recourse they had was to sue the employer. In fact, what many employers did in that situation, say, okay, once your appeal is done, if you're going to sue us, you have a period of time to do it. If you don't, too bad. Well, to sue in federal court will take anywhere from $25,000 to $50,000, and most employees don't sue. This is another mechanism where the state has set up an independent, outside the employer's plan, to review the decisions of the employer and the insurance company to decide whether they went through the process and whether they decided the appeals properly. So, and again, prior to ACA, only workers and insured plans the right to independent review of a denied claim through the insurance company. But this is outside the insurance company. So both insured or self-insured plans, now the states have set up a third party to review all the decisions. So this will be eliminated. And I just had a client go through this, and the state decided against the employer. They felt that the insurance company and the employer didn't view the plan properly, and she was granted benefits. So, I mean, this is something to keep the employer and the insurance company a third eye to look at this, and I think this was an extremely important development.
So, Larry, let me pause you there because we've had a couple of questions from our audience. Most surrounding, what are some of the next steps? So, a question from Joe who asks, if the Texas decision is upheld, how much time will the insurance marketplace be given to respond? Will they be required to carry policies through the next open enrollment period, for example?
Well, if anything's going to happen, if the appeals court makes it, let's say it makes its decision known in October. Now, what to look at in this situation is to look and see if the appeals court grants an injunction on the application of ACA, which means are they going to meet that? Are they going to make the ruling effective immediately, or what are they going to do? So in their decision, and the district court didn't do this. They didn't come down with an injunction to stop Obamacare as soon as possible. So that's the first thing to look at. So what may happen is, depending on what the district court does, when it's appealed to the Supreme Court, either party, it's going to be important to see what the Supreme Court does to countermand the action of the Court of Appeals. So I would imagine the situations, nothing is going to happen in regard to either the individual or the employer market until sometime in 2020 or 2021. That's what I would think, because it would be extremely disruptive if all of a sudden the district court said, we're issuing an injunction now, as of this date of the decision, Obamacare is gone. It would be catastrophic. The states and the federal government would have to scramble. So I don't think that's going to happen. They understand the impact of this law if it's repealed, and I don't think the a Court of Appeals is going to issue an injunction, but I could be wrong. Joe, you say you had another question.
Yes, and so this would be a continuation. If a participant has pre-existing conditions, can the current insurance company require the employee to go through underwriting at renewal?
If it's repealed, absolutely. I mean, absolutely. I mean, this is something that's why the impact of this is going to be very interesting, because currently on the small plan market, there's no community rating on the small plans. And it's going to have a huge impact on the individual market. I remember applying for individual coverage years ago, and the applications were 5 to 6 pages long, and you had to remember every ailment you had for the past 10 years. So that's going to come back again if Obamacare is repealed. So that's going to be extremely important to see. All right, let's continue. Let's look at one of the aspects of the small plan market, which is, again, another aspect which is very controversial, is this slide right here, essential health benefits. All ACA-compliant health plans in the individual small market must cover 10 categories of essential health benefits, including hospitalization, outpatient medical care, maternity, mental health, substance abuse. And so basically what it did, for the first time, the federal government said, if you're going to offer coverage in the small and individual market, your coverages had to include 10 benefits. And one of the controversial was maternity care was included. Even if you were single and 22, you still had to pay for that. And that's because they wanted to create a market for that. Now, this was important because of the fact that this used to be the purview of the states. The states determined what had to be included and the mandates that had to be included in their coverages that were written in that state. For the first time, the federal government said, we're going to require some requirements. And I mean, and also pediatric dental and vision was included. And so this is the reason why in the individual and small plan markets, costs have increased, because for the first time, all these benefits had to be covered. So, so again, as this slide indicates, in 2013, before ACA, essential health benefits took effect. 75% of non-group health plans did not cover maternity care. 45% did not include or cover substance use disorder treatment. And 38% did not cover mental health services. So again, people are complaining of increased costs. This is the reason, because the coverages in the individual and small plan market were more robust. So I think that's the reason why increased costs. Out of pocket for employers, the annual limit in 2013 was $7,900 individual, $15,800 for families. And prior to ACA in 2019, 19% of all covered workers had no limit in out-of-pocket expenses. So again, this is something that there were no rules on. Now the federal government said you have to have rules on exactly the limit on out-of-pocket cost sharing. So, among those on out-of-pocket maximum, that all expenses are counted. For example, in 2019, among the workers in PPOs with out-of-pocket maximum, 85% of the plans did not count prescription drug spending when determining if the enrollee had reached out-of-pocket. So for the first time for employer plans, there was uniformity in the country of exactly what could be counted for out-of-pocket spending. This was extremely important. Minimum mental loss ratios. In this situation, insurance companies were required to spend, depending on the size of the plan, 85% on coverage. And for large market, it was 80%. So insurance companies were mandated, instead of spending money on administrative costs, to spend money in actually providing coverage. And many employers got rebates. And as this slide indicates, $4 billion in the medical loss ratio rebates have been issued to individual small plan and large plan markets from 2012 to 2018. So the insurance companies who didn't meet those rules had to return money to individuals and to employers because they didn't meet the requirements. Now, also too, and I don't think this is effective, consumer information and transparency. All non-grandfather plans must provide brief summary of coverage and benefits in plain language. That's the SBC. I don't know how effective that was, but that was part of the requirements that it had to be uniform. It had to be 8 pages, a summary of coverages. And I think this was extremely important in the small plan market because, especially with smaller and medium-sized employers, many times they didn't provide any summary of benefits. And if they did provide summary of benefits, it was so long and complicated. Most employees did not read at least something that the employer received that summarized exactly what coverage they received. Now, one of the most controversial and more complicated sections of the ACA was the employer mandate. So it requires employers with 50 or more full-time employees to provide health coverage. And if you didn't, you would pay 1 or 2 penalties, a $2,000 or $3,000 penalty. If ACA goes away, this mandate goes away, and the ill-advised reporting would go away too. Because there's no reason to report to the government if the employer mandate goes away. So that reporting for the employer mandate was one of the more complicated aspects of the ACA.
I had a question I'd love to share. This one comes from Richard C. Richard's asking, what was the medical cost growth percentage the years before ACA, and what has it been in the years since? Is that?
I don't have those figures, but I mean I've looked at this for the past 15 years, and supposedly, and this is off the top of my head, the increase in the increases have been less under Obamacare than before, because I started looking at this probably in 2003 and 4, and throughout the 2000s, healthcare costs were increasing at an alarming rate, and it's still increasing, but I don't think the increases have been as severe as it was in the past. But that's just off the top of my head. If you want to see a study on this, the Kaiser Family Foundation does a great report on employer coverage. Just go to their website, and it's released every year, and it has details of exactly of the increases in premiums on employer coverage. That's the best place to look. Joey, any other questions?
Yes, one from Donna, who asks, since the mandate has been reduced to 0, do employers still have to produce the 1095-Cs and 1094s?
Well, it was only the individual mandate went down to 0.
Yeah, but the employer
so it wasn't the employer.
Remains.
Right. Now, here's the question here, and we don't know the answer to this yet. Insurance companies had to give if you had an insured plan, employers had to, the insurance company had to give the employees a 1095B, and the purpose behind the 1095B was to indicate to the federal or report to the federal government whether that person had coverage. Now, you didn't have to attach the 1095B to your tax return because there was a question on your tax return whether you have coverage. The issue is going to be in 2019 whether the government is going to require either the 1095B to be issued, or if you're self-insured, whether Part 3 of the 1095C has to be completed, and we're waiting for that.
Thank you.
Also, another aspect of employer coverage, all employer plans have to have a 90-day waiting period for new hires if you're full-time. Also, what's going to go away, if you have variable hour employees, the ACA created a very complicated variable hour employee. If you have employees that sometimes work 30, sometimes 20, a very complicated aspect to determine whether you're full-time or not. All that aspect will go away if Obamacare is eliminated. Now, here, prior to the ACA, as this slide indicates, 29% of covered employees faced a waiting period of 3 months or more. Another aspect of Obamacare is that limited emergency room costs. Here, as this says, if a patient is taken to the emergency room and is not part of his or her insurance network, the ACA requires all insurance plans to charge and put patients on out-of-pocket costs that are equal to in-network rates. Because sometimes in the situation, you don't know if certain providers in the emergency room are independent or in the network. So no balanced billing protection if repealed. So again, if you've ever been to the emergency room, you know that's going to be an expensive place to be. And sometimes it's in network and sometimes it's out of network. Also, what ACA did, they mandated coverage for mental health and substance abuse. Under ACA, employers must cover mental health and substance abuse disorder that are comparable to general medical care. Prior to 2008, nearly 2/3 of the people with employer-sponsored health coverage had specific limits on inpatient behavior health care and 3/4 on outpatient behavior care. This is part of ACA, but also part of the act that came out in 2000, I think 5 or 6, and the ACA just built on that. All right, Julia, do we have any other questions? As you can see from this presentation, there's many aspects of Obamacare that, if eliminated, is going to cause some havoc and some uncertainty. So it's going to be important to look at over the next few weeks and months to see exactly what the courts are going to be doing with this and how the Congress deals with this. So there's going to be a big battle in 2019 and 2020 about what to do about healthcare. And I think it's guaranteed this is going to be a big issue, especially in the 2020 election. Julia, do we have any other questions?
At this time, I would like to ask anyone with remaining questions to add them here. Is it safe to say, Larry, while folks are chatting and any questions they might have remaining, is it safe to say that let's assume now and through the end of next year, status quo, employers should continue doing what they're doing and watch this space for more?
And if we have a court decision, I will be the first to have something come up because I know everybody's going to be interested in it.
Very good. Well, no further questions at this time. I want to thank everyone for joining us and thank Larry very much for guiding us through this important topic.
Take care. Bye-bye.
Thank you. Bye-bye.